And we are so excited to be here with you for this presentation on medication and mind fog. Is it dementia or is it your meds? We'd like to thank our hosts and our partners in this, the Cleveland Clinic and the Lou Rouveau Center for Brain Health, our host, the MLK Center in Las Vegas. Thank you so much for making this all happen for us and making this education available to all of you out there who are listening. I understand that we are live streaming today as well. So I believe our reach is wide, and we are really looking forward to spending this next hour with you. If you are available to ask questions, if you're in a format that you can ask questions, please do feel free to send those questions in. We will try to address those if we see any of them come through in whatever manner you're able to bring them to us. Our host will be facilitating those. You may also go ahead and we'll give you some contact information at the end. If you have questions, please make notes of them, and we'll give you a place to send those questions to at the end of the presentation this morning. So again, we look forward to spending this hour with you. I'm going to go ahead and turn this over to our presenter today. Browne is the founder and president of Dementia Care Education. He has a graduate degree in neuroscience and more than 20 years of experience and expertise in the field of Alzheimer's and dementia research and education. He is a executive board member on the with the Alzheimer's Association. Sorry, it's Monday morning. I'm tripping over my own tongue. Executive board member of the Alzheimer's Association and a consultant with the Cleveland Clinic, as well as a proud board member of the Fellowship of Christian Athletes. So Brian, if you're ready, I'm going to go ahead and take myself off the screen and turn this over to you.
Good morning, everybody, and it's great to be here with you. Today's presentation is something that a lot of people have on their mind. Why am I so foggy-headed? Am I getting Alzheimer's disease or some form of dementia? Boy, oh boy, I wake up and I'm just not clear at all. I go through the day struggling with just clearing my thoughts and doing things. And so what's going on? So today's presentation really addresses that. And so for the next 40 minutes or so, we're going to have a discussion about what potentially could be going on in your brain. Medication or mind fog. So what we do know is this: as we age, the body starts to change with the aging process. And this aging process leads the body to sometimes not work the same way as we were when we were younger. Aging has a definite rate that's attached to it. And this rate of aging starts with small changes that work all the way up to bigger changes. And so by the time we become 65, our bodies aren't working the same way as they did when they were 25 or 35. And that's normal. But oftentimes, there's a little bit of problems that happen along the way. Some diseases kind of spark up. And so we know the aging process is normal, but our brain even starts to change with what's transpiring over time. Our systems in our body, our circulatory system, our digestive system, our liver, our kidneys, everything starts to slow down. So again, it's working fine for our age, but it's not the same as when we were younger. And because of that, our body's ability to do what normally it does without any problem, it has a little slow down, or sometimes it doesn't do it as efficiently. And one of the things that fall into that category is our body's ability to break down and use medicine. It's our body's ability to break down and use anything. Our gut doesn't work the same way when we age as it did when we were younger. And so therefore, even our relationship to food, but what we're talking about today, our relationship with medicine, changes because our ability to break it down has changed because of the way that we age. So that's kind of the backdrop. This is a process of aging, and that's why it's so important that we age well, but also mitigate for the things that we can't control. So according to Medicare, this is the truth, that the majority of us have multiple chronic conditions. And that's important to know. Multiple chronic conditions. So again, when we're younger, our bodies work great. And then as we get older, we get these chronic conditions. We become at risk for things like heart disease, high blood pressure, high cholesterol, diabetes, maybe some arthritis is happening. We have all of these hormonal changes that go in our body. And so as you get older, Medicare reports that the majority of people have over 2 chronic conditions. So if you look at the right 3 bars, so the majority of us have 2 to 3, 4 to 5, or over 6 chronic conditions, and just only 30% of us have 0 to 1 chronic conditions. So about 70% of us have 2 or more. Well, that's a lot of things going on. And guess what? For every chronic condition that you have, there's a medication that typically goes along with it, a medication or 2. So think about that. All the things I mentioned, everything from heart disease, high blood pressure, diabetes, high cholesterol, arthritis, all of those things have medications attached to it. So as we age, we become attached to medication. So here's what you have. So on average, 3 chronic conditions with 5+ medications. And you're 3 times more likely to be hospitalized as you age. So this is the perfect storm that we're living in right now. We're living in a time and a place where people are taking a lot of pills for a lot of different conditions. And like we talked a few slides before, the way our body processes all of that, all the medications and therapeutics that we take change over time. So that sets the backdrop for where we are right now. And then we see a number of other factors that are related to our medication use as we age. Polypharmacy going all around the place and taking a lot of medications all around. And then each medication has this complex medication instructions that follow it. Some of them say take on an empty stomach. Some of them say take with food. Some of them say take only in the morning. Some of them say you take 3 times a day. Some of them say that you take at the same time of the day every day. Wow, there's a lot of instructions with each medication. So you really have to be on top of it. And then get new medications because of a recent change in your medical status. So that comes into play. Oh my goodness, another one. So a traditional pill box doesn't do it justice anymore, because a typical pill box means, oh, I'm just going to take all of these pills at the same time right now. But with complex instructions, a pill box oftentimes is incomplete in what it really has to do for you to be able to adhere to what, where, when, and why. And then if you've been in a hospital or a rehab or an urgent care, all of a sudden, the instructions that you get at discharge when you leave the doctor's office or the rehab or the hospital is completely unclear. You don't know, do I continue the medications that I was on before I went to the hospital, or are these new medications, or is there a new system that I'm on? So you're completely unclear. You see all of these factors that start to really make your life difficult in terms of understanding. And there's more factors, Now, we know that there are people that are at risk for more of this than others. So if you have multiple chronic conditions and you're taking more medication, you're at greater risk than people who aren't. And then there are people who take certain medications from several different categories of drugs. So there's different categories of medications that are out there that oftentimes don't play well. And then there's different classes of medications as well. And we're going to talk a little bit about that in a little bit. So if you're taking different categories, different classes, and taking more medications, you are ripe for this medication mind fog, this phenomenon that has happened to a large subset of our aging population. So let's take a look at what happens both in the community and in nursing homes. These are typical. So what we know is this: medications can interact with certain foods. Not all the foods we eat play nice with the medications that we eat. So we have to understand that we get these side effects from oftentimes certain foods that we eat. And then any of us take supplements because we're not getting enough vitamins and nutrients. And sometimes the medication that we take interacts only with some of the supplements that we take over a period of time. And then we'll have natural products. We say we want to get the natural version of something, and sometimes those natural products oftentimes don't play well. Or you say, you know what, I'm going to take my medication with my nightly glass of wine or my alcoholic beverage. And you have to realize that you speed up and oftentimes alter the enzymatic response to our medications by taking it with alcohol. Or we have other health conditions that just amplify and don't play nice with the medications. So we see all of that happening specifically with people who live at home. Now, how about people who live in nursing homes? They take on average 8 scheduled drugs a day. And then there's an additional as-needed drugs, 3 PRN per each resident. So, for example, all of a sudden a resident says, oh, and now I can't sleep. Okay, we're going to give you your sleeping pill for tonight. Oh boy, you know, my back aches now because of something. Okay, we have a PRN medication for your back. So all of a sudden, we see 40% of all residents in nursing homes take over 9 medications a day. And half of those are those as needed PRN drugs. So we are taking a lot of pharmacy as we age. It's a product of aging. But there's a lot that go into that we don't realize that we're putting in motion. One of the things that we're putting in motion is this concept of the knowledge that every medication and therapeutic has a side effect that's attached to it. That's a truth. And it's something that happens now. Not all side effects affect everybody, but because we're all different, we all have a different makeup, that some drugs respond one way to certain people and they respond a little different on the side effects with another. But it's something that we have to consider. And some of the side effects could be anything from feeling drowsy to being very, very amped up and excited. Give you an example. Some of the side effects that you'll see on drugs, that they will tell you cannot drive or operate heavy machinery because it may make you drowsy. Others say that this may wind you up and you need to be able to be in a place where you don't have to concentrate because it may wind you up too much. Those drugs that have caffeine in them or some other stimulant in them have that side effect with them. So side effects are common in all medications. But what happens if we're taking a bunch of medications with a bunch of different side effects? Boy, that could be a recipe for disaster that many of us are living in right now and not even know it. So this talk that we're having is here to amplify it, will give you awareness that you may be taking a number of drugs that may not be playing well together, and you are the recipient of really not feeling like yourself. How many of us have woken up day after day and we say, boy, I just don't feel like myself. Something's going on, I just don't feel like myself. How many of us have felt that way? I felt that way. And I had to do a little bit of come to Jesus with myself and say, what's going on? What's making me feel like I just don't feel quite right? And I know I wasn't the only one feeling like that. I know there's a number of you out there that just say, geez, I just don't feel quite right. So why are so many meds out there? So, of course, we talked about earlier, older persons have multiple chronic conditions, which leads to medications. But also, physicians have this pressure to prescribe. When you go into your physician's office with a legitimate ache, pain, or situation, you want them to do something, which oftentimes means prescribe a medication. So there's pressure on them to prescribe. So what do? They take out their prescription chart and they then write to another prescription. Then we have the phenomenon of this fragmented assessment in care, where we see so many different physicians and so many different practitioners doing so many different things that nobody's reconciling all of the information. We think that the medical system is keeping track of this, but here's the truth. The medical system is not keeping track of it. Because of the multiple practitioners, multiple physicians, and multiple chronic conditions and very different locations, believe it or not, you're the only one with all the information about what's transpiring. And if you don't have a clear-cut knowledge of what it is, don't expect anybody else to. And then we get practitioners and others treating symptoms rather than the underlying problem. So we see this happen all the time, and this is why the prescription pad is powerful, is because we oftentimes treat the symptoms with a prescription pad as opposed to going to the root of the problem. For example, we see some people with hyperlipidemia, which is high cholesterol in the blood, which is a risk factor for so many different things. So we will start to prescribe one or two different cholesterol-lowering drugs without going to the root of the problem, which is our diet. If we changed our diet and moved our bodies, our God-given natural abilities to reduce our cholesterol is right there. So let's go to the root of the problem and start there, and then supplement that with the lower doses of medication than putting people on a bolus dose of medication to treat something. So we need to work in conjunction with the way that we're created. Let's look at solving the underlying problem and treat appropriately with medications. And that doesn't happen a lot. We continue to just give medications for the symptoms. So we really got to reconcile that. And part of it is you suggesting with your practitioner, are there other methods and means I can use besides medication to get at the underlying problem? Again, type 2 diabetes, there are things that we can do that can reduce our reliance on things like metformin and insulin on a regular basis. So again, looking at the root problem. So there's these things that look like dementia, but aren't dementia, and they're called pseudodementia, and they're treatable conditions that dementia specialists go through their checklist and make sure that it's not this versus that. And one of the pseudodementias is what we're talking about today, which is drug reactions and drug interactions. When medication that we take for legitimate medical problems start to interfere with our brain and our cognition and how we feel, that we wake up day after day with this mind fog, this heavy head, I can't remember anything, and I'm walking around in a cloud, in a fog, and I don't feel like I'm quite right, and I'm off here, and all of those things, and that pseudodementia of medication mind fog is so common because of everything that I laid out just before. The whole notion of, guess what? You have these chronic conditions that you need medication for, and it starts that web of events. So this is how medication starts to act on your brain. It starts to affect your ability to think, to understand, to learn, to plan, and remember. Anyone wake up and just all of a sudden feel like, man, I'm like 2 steps, 3 steps, 4 steps behind everyone else. And then some of the side effects can even cause confusion when they're in a state of confusion saying, hey, let me get this straight. Let me really get this straight. And then you're not remembering certain events from day to day, and you have family members saying, I just talked to you about this. Don't you remember? And you're saying, oh man, I really don't. And then you have some hallucinations and delusions, and you're wondering, did that really happen? You start thinking, did that really happen? And you start to question yourself whether things really happened or not. So you're in this world of hurt. And some people mistake all of these cognitive side effects as a form of dementia, like Alzheimer's disease. And I'm here to tell you, a lot of what you're experiencing or potentially experiencing is the pseudodementia of medication mind fog by your medications not playing well together. And I know some of you out there are just shaking your head and saying, could this be the reason I feel so confused in the morning, or I just don't feel quite like myself? And I'm here to tell you that may be the reason. Because as we're taking these medications to help us, they oftentimes just don't play well together. So we have these different areas of the brain that are responsible for these different processes. The frontal lobe right here is our problem solving, our self-regulation, our goal setting, and our social cognition. And when medications don't play well together, it changes the way that we react to people. Excuse me. Excuse me.
Bless you.
Bless you.
Excuse me. Calling in the air right now. So when we typically have self-regulation and we set goals and all of those things, usually the goals that we set, we remember and we say, okay, I've got this appointment at this time. I know I need to get dressed or get a shower before that happens, and so on and so forth. But oftentimes when your medication has you in a brain fog, you can't even keep track of time. Before you know it, you look at the time and you say, oh my goodness, it's 11 o'clock already. Where did the time go? I've got to get showered because I know I have something coming up. What have I got coming up again? What have I got coming up again? And we start to forget things, and the goals that we set are all shattered because we're in this fog, because time's just going at a different pace, and we're confused, and all the things that our frontal lobe is responsible for becomes cloudy and foggy, and we're not our sharpest and our best. And then we go to the occipital lobe. This is where our vision and perception, our perception of the world around us comes from our occipital lobe. So all of a sudden, when that becomes foggy and hazy, that, I don't know, it could be this, could be that. Oh man, I don't really even know what to think about that. And you're so wishy-washy and indecisive because your perception of the world isn't clear and straight. When I wake up and I'm on my game, boy, I'm firing on all cylinders and I perceive things and I'm on my game. It makes a big difference. But anytime I'm foggy-headed, I'm just, that indecisiveness, oh boy, is that really what I'm seeing? My perception, remember I talked about people having sort of a little bit of an altered reality. Did that really happen, or was that a dream, or was I imagining that, or is that real? This is a part of the brain that helps you perceive all of that. And when you have this medication mind fog going on, your perception, your vision in the occipital lobe becomes affected. And then the parietal lobe, this is our visual spatial abilities, our ability to navigate with the world and move and walk and not fall down and do all the sensory things to be able to get all of our senses in play. And all of a sudden, that becomes compromised when medication is just clouding everything. I'm more at risk for the number one cause of morbidity and mortality in the United States for people 65 and over. The number one cause for that is falls. And when my sensory motor perception and my spatial abilities become affected by that, I'm at risk to fall down because all of a sudden I didn't notice or didn't see or didn't pay attention to that chair there, and all of a sudden I fall and take a tumble. And when you age and you fall and take a tumble, boy oh boy, break a hip, break an arm, have a brain bleed because you hit your head. There's so many things that can go wrong when that happens. So with that, we get this situation that our parietal lobe is exposed to these drugs, and we become unstable on our feet. You've probably seen some people who shouldn't be driving when they're on their medications because they become unstable behind the wheel, and they're driving over curbs and stopping right on the bumper of the car before them, or stopping 20 feet back and doing things like that. And that's because the medications aren't playing well. So our parietal lobe becomes affected. And then we have the temporal lobe of the brain. which becomes affected by this barrage of all sorts of medication that comes on it. So our memory's foggy, our emotions get wonky, meaning that sometimes you'll see people cry at the drop of a dime or become angry really quickly, they become short-tempered, and this is a medication really playing tricks on your emotions. And your language. When you're foggy-headed, you start repeating yourself, you're thinking, did I say that already? How many of us have said that before? Ask ourselves, have I told you this already? Have I said this before? And we're unsure about our language, and we start, like I said, repeating ourselves. We start doing all sorts of things because we're unsure, because our short-term memory is becoming fried with all of these medications that are part and parcel of what's transpiring in our brain. So we're just not ourselves. And I've felt it, and I know you have as well. And it really depends on what you're putting into your body. So it affects all the major areas of the brain. And so it does this because it alters the normal brain chemistry. We have these neurotransmitters that send these signals across each one of our neurons to communicate. When we alter the chemistry of our brain, these neurotransmitters that start to communicate with all different parts of the brain, we start not to be able to do that effectively anymore. So the communication's off, which sends these wrong signals, and all of a sudden it starts to exhibit a different effect than normally what would happen. It either excites us too much or inhibits something, and anytime that happens, we're off kilter. And that's medicated through the drugs that we take. So our drugs alter the chemistry, which alter our neurotransmission, which alters the way that we think, perceive, memorize, all of those things. We're way off because our drugs aren't playing well. So 3 major neurotransmitters that have normal action that make us who we are. Let's talk about norepinephrine first. And our norepinephrine helps us with our alertness, our concentration, and gives us energy. We need it to be able to focus and do tasks and do all of those kind of things. And when we're off with our norepinephrine, all of a sudden we become anxious and impulsive and irritable, and it changes who we are. And then serotonin is another neurotransmitter that helps us, with our obsessive compulsive behavior. It really regulates that. It really helps our memory. And when that is off, we are all over the place. This is where we start thinking, did I do this? Did I not do this? Boy, I really need to, and you go into this big exaggerated version of who you are, exaggerated one way or another. And that's where we have our either obsessive or compulsive. And all of those things start to affect, just the way that we even relate to others. You ever been really, really irritable? Really, really irritable with somebody for no reason? And then we have dopamine. Dopamine is another neurotransmitter that is our reward centers of the brain, our pleasure. It is the thing that gives us satisfaction. And when that is off, all of a sudden, it changes everything. Our cravings are different. We'll become aggressive. It changes our mood and our cognitive function. We can't pay attention. All of those things are off because of our dopamine response. It's off. So all the drugs that come into our body change the chemistry, change neurotransmitters, and make us susceptible to becoming someone different. And when we're someone different like that, we start thinking, what is going on here? Am I going down this Alzheimer's and dementia aspect? Because ultimately, it starts to affect our memory, our cognition, our attention, our ability to do the normal things that we do on a regular basis. And that's all because we're taking multiple medications with multiple side effects that don't play well together. So, U.S. Institute of Medicine lists some classes and some groups of drugs that we know by research have an absolute effect on an adult's cognition. And here's the situation. Most of us don't know that this is the case. We are just taking the medications that our provider has prescribed for us. And with that, it changes everything. So let's talk about some of these classes of drugs as we take the next few minutes to see what we may be taking that may be giving us what we call that medication mind fog, that pseudodementia of drug interactions and drug reactions. So the class of anxiety drugs that by far are really one of the most prescribed classes right now out there is a class called benzodiazepines. And benzodiazepines are anxiety disorders, people who are stressed out or have some mental health issues and things along those lines. And they have a big sedative effect that oftentimes go into play and don't play very well in side effects for certain people. They cause memory loss by really dampening some of the activity in the brain, some of those neurotransmitter activities that we just talked about, and it starts to hinder our ability to transfer short-term memory into long-term memory. So we have this gap in memory. Something happened and we weren't able to even commit it to short-term memory, which means if we weren't able to commit to short-term memory, it doesn't become part of long-term memory. So this class of drugs really makes us look, for lack of a better term, foolish, because we'll be with people in an event seeing the same thing. And merely hours later, we have very little recollection of an event that everybody's talking about because it was just, you were in a fog and a haze and nothing transferred into your short-term memory to start the process of converting or transferring it to long-term memories. So you have very little recollection and everybody around you saying, you were right there with us. How could you not remember? You were part of the fray. But this particular type of medication dampens the ability for us to be able to do that. And so it treats things like insomnia and other types of anxiety and depression, which are common. And again, this is one of the most highly prescribed classes of drugs for these things, but it has this side effect that doesn't allow you to freely transfer memories over the long haul. So you're always wondering, did I really do that? Did that happen? So you have this fragmented, incomplete parts of your memory that you're trying to make sense of. And it's really, really hard. But some of these medications that are prescribed are necessary for you to be able to function over the long term. But we then have to start looking at how much of this should I be taking and how often should I be taking this. These are the follow-up conversations when we start to experience these pseudodementias. And so there's other conversations that need to happen if you find yourself with these types of side effects from taking any type of benzodiazepines. We then have another class of drugs, statins. And statins are for heart disease and to treat high cholesterol. They're common drugs, but they can cause memory loss as well. And they lower levels of cholesterol, and there's many multiple brain processes that are dependent on cholesterol as well. Some of the neurotransmitters are cholesterol dependent in terms of how that works. And so some of these things have an adverse effect in terms of looking at the neuronal formation of nerve cells and looking at the underlying parts of thinking and memory that are affected by statins, and it interferes with that continuum. So there's some people who need to take statins but are realizing, boy, I'm not sharp at all. And this then can lead to that conversation. Are there alternate classes of drugs, or is there a dosing situation that can leave me feeling better? So there's people who definitely need them and need to be on them, but we need to be able to adjust the right drugs and the right amount of drugs for you individually. Some people may not have the hardcore cognitive effects, whereas others, boy, it just wipes it out completely. But we know that it's part of the continuum of drug interactions and drug reactions that we see for this particular pseudodementia. We then have these anti-seizure drugs. And anti-seizure drugs have been prescribed for a number of different ailments, from nerve pain to bipolar and mood and things along those lines, and people with epileptic type events going on, brain short circuiting. And so this anticonvulsants really starts to dampen signals of the central nervous system. And the central nervous system sends signals from all over your body through your spinal cord and then to your brain, and then your brain acts on that. But because your central nervous system, some of the electrical circuitry misfire, and this is what causes seizures, it tends to dampen that to reduce your ability to have these misfires that happen. And it's been tested and it shows that it can do that. But any drug that starts to depress signaling in the CNS, the central nervous system, has a potential to not be able to record and to be able to give you the signaling that will really give you robust memory. So there's a risk-reward aspect in terms of how much of this should I be taking, how often should I be taking for me to be able to do what the drug is supposed to do versus having these side effects of memory loss. So looking for the consummate balance that needs to be done between a drug like this is paramount. So it's really important to have that discussion so that you're feeling your best and doing your best while on any of these medications. And then we have a class of drugs for antidepressants. And these antidepressant drugs really are for anxiety, eating disorders, OCD, obsessive compulsive, chronic pain, smoking cessation, and some hormone-related disorders and things along those lines. So it's a really popular class of drugs. But with that, we see a lot of people suffering from memory loss. We know that memory impairment is a big side effect from this, and it blocks the action of two of those neurotransmitters that we talked about before, serotonin and norepinephrine, which are key messengers for our brains to be able to take in information, store information, and subsequently retrieve that information. So that the messengers, the chemical messengers, interrupt that flow of creation, storage, and retrieval, which makes it really hard for people who are on antidepressant medications to have these conversions from short-term to long-term memories. And so we know that certain people start off with certain doses, but oftentimes those doses need to be adjusted for a number of different reasons. One, it's not doing its job, it needs to be increased, or two, it's doing its job, but the side effects are too great, so it needs to be decreased. So this is one of the drugs, one class of drug that specifically, the first dose that you get of this is never typically the final dose that you get of this, because we really have to see its effect on everything from your appetite suppression to your mood control to your memories. It needs to be adjusted, and you need to be able to have this honest discussion with your physician or mental health practitioner to be able to kind of find the right dose that works for you. Otherwise, it's really right to block the signaling that really will allow you to create short-term memories and convert those into long-term memories. And then we have the class of narcotic painkillers. They're prescribed because we're in pain, people who are in chronic pain. So I named a whole bunch of chronic conditions at the beginning of our talk. And I mentioned even arthritis is a chronic condition. And arthritis is an autoimmune disorder that has pain attached to it as well. When this autoimmune effect starts to attack the joints of the body, in your hands, in your elbows, in your knees, in your back, shoulders, you have all of this pain that goes with it. And oftentimes we use this narcotic painkillers to help relieve the pain of things like arthritis and other chronic conditions. You ever have a bad back or just a chronic bad back and you need to do that? Well, these narcotics, they work by, when they dull the pain signals in our body, it blunts a whole lot of things. And one of the things that it blunts is our aspects of cognition, our ability to remember and stay present in the space. And this is why typically there's a warning on any kind of opioid narcotic that says you can't operate any kind of machinery or anything like that because you aren't in full control of your faculties. And oftentimes we've seen people obviously abuse narcotic and opioid pain medication and go through large gaps of memory loss because of that. And so when you use them for extended period of time, i.e. for chronic pain, we see this more and more. When you depend on these opioid narcotics on any level for a long period of time, it will start to give you memory gaps and your ability to string together thoughts and that. Now that in combination with some of the other drug classes that we talked about, it's a recipe for disaster. So next, we're going to talk about Parkinson's drug. So Parkinson's is another neurodegenerative disease of aging. And people are prescribed Parkinson's drugs for a myriad of reasons, but typically to stop tremor, the shaking that we see, and restless leg syndrome, where you're having this involuntary movement. And we know that, Parkinson's is derived from this lack of dopamine production in the body. And it's involved in this chemical messenger system through neurotransmitters. So we know that all of a sudden, because of this messenger system being interrupted, and we're trying to recreate that with some of these Parkinson's drugs, we have these big side effects that happen, which turn into confusion. We have depression, delusion, we have memory loss, compulsive behaviors, all string to it because a lot of these Parkinson's drugs are there to stimulate these neurotransmitter responses. And with that, we get exaggerated effects or exaggerated side effects that come with this ability to give you back smooth articulated motion. So some of the side effects are, boy, you may be able to do some of the things that you wanted to do in terms of your motor movement, but you're foggy headed while you do that. So there's this trade-off that you end up sometimes sleeping for a large part of the day just because you're just so foggy headed and you have some off time. So there's a juxtaposition of balance that needs to be had when you're taking Parkinson's drugs in terms of the benefit and then some of the risk factors, side effects that come with that as well. And then we have hypertension or beta blockers, and those are heart drugs that we take for people who are at risk for heart disease. And we know that they slow down the heart because one of the things when you have heart disease is you typically have high blood pressure, and so we slow the heart, lower your blood pressure, which is more healthy for you. But oftentimes, all of those things stop and block a key messenger in the brain. A couple of those neurotransmitters that we talked about before, which have then an effect on your memory, your mood, and your cognition. So again, you need it so that you can stay alive because heart disease is the #1 killer in the United States. But again, this is a dosing thing as well. We want to make sure that it's giving the maximum benefit without the maximum side effects that happen. So we see beta blockers be part of the continuum. We turn next to sleeping aids. We know that getting a good night's sleep is essential for overall health, specifically as we age. And oftentimes we take the Lunesta, the Sonatas, the Ambiens, and things along those lines to help us go to sleep, or even the Tylenol PMs, the over-the-counter version, because we're so desperate for sleep. But these sleep aids really start to affect the whole continuum of memory because it puts you into almost a suspended state that doesn't give you the restful sleep that you need. And oftentimes, all of the chemical messenger signals that should be normally sent during when we sleep are interrupted, so you end up feeling completely scrambled when you wake up. Although you may have got hours of sleep, it wasn't the type of sleep that is beneficial to cognition. So you end up being foggy-headed even though you've lost hours of sleep. And oftentimes those types of drugs have a little bit of an addictive property to them. You become addicted to saying, I need to sleep, or so I need to take these drugs. So oftentimes they're counterintuitive for what it's actually used for. there's better, more natural ways that we need to look at providing sleep for ourselves, or at least reducing the dosage if we have difficulty falling asleep. So again, the Tylenol PM, again, that's an over-the-counter version of these, but does the same thing and keeps you scrambled and fried. There's these incontinence drugs that are out there that help with overactive bladder, and it blocks acetylcholine, which is a chemical messenger that we need for memory. So this class of drug oftentimes starts to mess with your mind and mess with your brain. And these, what I'm talking about, are all common forms of drugs for people who are aging because of those chronic conditions that we talked about earlier. Now, part of what we have to understand is, even if we took one of these drugs, is having these effects like we're looking at, but the interaction of these drugs with other drugs amplifies what we're talking about. And when you have multiple chronic conditions and you're taking multiple drugs from these categories, you see where the medication mind fog can happen. One drug in itself can wreak havoc on you, but imagine taking drugs from all of these different categories for all the chronic conditions that you may have. It is a recipe built for disaster. And people are walking around right now thinking that they have dementia or on the verge of dementia, when it's simply the medications aren't playing well together. That's what you have to learn today, is the fact that what you're experiencing, the foggy headedness and the confusion, may not be a dementia process, but a medication process. Antihistamines the same way. Allergy season has come out right now, and we know that even some over-the-counter antihistamines can have that same effect on you. And we need antihistamines, but we need to have the right ones with the least amount of side effects as well. So how do we prevent this medication and mind fog as we wind down our presentation? So there's one place in the healthcare continuum where we can get this assistance. Because of the fragmentation that we talked about earlier, that we're seeing a different practitioner for every different chronic condition, there's no one talking about this particular. But follow this example now. You get a new prescription from a physician or a practitioner. You go to the drugstore or the pharmacy, and by law, when a pharmacist fills a prescription for you, they have to ask, do you want a consult with this medication? 99% of us say no. We just want to take their prescription and leave because we've been waiting for a long time. That is the only place in the healthcare continuum that you can get all of your medications reconciled, is at that consult. And it's so important that you recognize that and are prepared for that consult as well. So the first thing is, don't say no to that consult. But secondly, come prepared for that consult with a list of all of the medications you're taking, including your over-the-counter medication and the supplements you're taking. They can enter that into their computer and start to reconcile your medications. They'll start asking you, well, what are you taking this for? And so on and so forth. And they'll start to help you reconcile what's transpiring. And that's important because some of the medication that they'll see that doesn't play well together, they'll have a red flag and say, you need to go talk to your doctor because these medications together are toxic. So it starts this conversation that you need to have based on the information that they'll present you with. Or they'll say, you probably shouldn't be taking this supplement if you're taking this because it's going to lead to that. So when you get a new prescription and you take it to the pharmacy, come prepared to go to your pharmacist with a list of all the medications that you're taking so that they can reconcile it for you so that you can get out of this medication and mind fog, or medication is not working well together, or supplements or over-the-counter medication that are not working well with the prescribed medication. And then you have the conversation with your doctor, what can be eliminated or the dosage reduced or so on and so forth. But you need that reconciliation, which is really important. And then, don't stop taking medication until you talk to your doctor, but this is the first step and the place within the continuum that is designed to help you do that. So that's one of the key things that everybody needs to do. Now, Some of you get your prescriptions from a pharmacy benefit manager, and you get like a month or 2 months or 3 months worth of prescriptions mailed to you by a pharmacy benefit manager. You can do the same thing by emailing your pharmacy benefit manager a list of all the prescriptions you're taking and say, how does this particular prescription play with all the other things that I'm taking? So that's where you have to track them down and give them that email with everything that's going on. And by law, they have to respond based on that. So there are some ways that we can naturally get the information that we need. And it's important that you or someone who's responsible for your health is able to do that. It's really important. So what questions should you ask? Let's talk about some questions you should ask as we close. First question is, what is the name of the medicine and why am I taking it? There's a lot of people who almost go into autopilot with their physicians or practitioners who don't ask the questions. So you want to know what the name is and why are you taking it. It could be something that you don't realize you're having. It could be something like a diuretic because they say, you know what, you're carrying too much water and so we're giving you a diuretic to basically lessen the amount of water that you're carrying. But that diuretic may dehydrate you and cause some other alternate side effect for some other medication that you're taking. So you need to know what it is and why you're taking it. Second, how long will that medicine take to work and when can I stop taking it? So is it going to work immediately or is this something that I need to take for a long period of time? Am I going to get to stop taking it or do I, is this part of my lifestyle now? Asking those questions is important. Some of the medications you may take are antibiotics, and sometimes we have a bad habit of not finishing our course of antibiotics, and we get infections that continue to mount up and mount up again. And other things we have to take because of chronic infections for a longer period of time. So those are questions that we need to have asked and answered. And then, does this medication have any side effects on my body, brain, and when should I call you about when I really don't feel well? If it's an out of line kind of side effect. So asking those questions are really important because if you take a medication, you feel awful, but you think you're compelled to take it because your doctor told you to, ask the question beforehand and say, how am I going to feel on this medication? And when is feeling the way that I do something that should concern me for me to contact you again? Definite questions to ask. And then, could this medication affect my cognition? And if so, how can I protect myself against this? I don't want to feel that way. So that's really important for you to be able to have that conversation. And then the big one, can I mix this medicine with other drugs I take, whether they be over the counter or supplements, or, like I said, those aspects of other chronic conditions. And if you can get in front of your doctor to do this, fantastic. But like I said, the pharmacist is designed to be able to look at multiple classes of drugs for multiple medical conditions and to reconcile that for you to have that conversation with your physician. And then, is there another drug or non-drug treatment that might be safer or more effective for my body and my brain? What are the alternatives to taking some of the toxic drugs that we take? And that's a good question to ask your practitioner. Just, is there something else I could be taking that may be a little bit softer on me so I don't have these side effects? Because, many times there are other things that can be used to treat the same condition with less side effects. Have that discussion. Side effects are a real thing. And again, medication and mind fog will keep you disabled unless you get them reconciled. So you have to, one, discuss your list of medicines, again, with specifically your pharmacists and your healthcare providers. Number one, describe any new or existing problems you have with your cognition. And even if you think they're not related to what you take, have the discussion about your cognition. And then use your healthcare provider, use the information that you get, and to get the best treatment possible. Continue to have the dialogue, and your healthcare provider will use this information to give you the best information that you can. Use the healthcare system to your advantage. It's that way. So become proactive because really, medication and mind fog is one of the biggest pseudodementias out there that will keep you from living your best life. Break out of that constant mind fog and the slowness of thinking and all the things, the lack of concentration that come with this and your medications. So we want you to be proactive with your health and get your medications reconciled so that you too won't have medication and mind fog. We invite you to ask questions and I'm going to turn it back over to Karen. She's going to give you information for what's coming up and an opportunity to participate in things like memory screening, which will help us get a baseline of your cognition so that you can make good choices. And again, on behalf of the Cleveland Clinic Center for Brain Health, we invite you to be part of the conversation and to go to healthybrains.org to find out a lot of what we're doing on there in terms of all the clinical trials and the clinical medicine that we have to help you with your cognition. So all of these things are part and parcel to what we want to do. So I'm going to turn it back over to Karen.
Okay, Brian, thank you so much for all of that valuable information. And you may or may not have seen in the chat box that there's a comment out there that say yes to the consultation. A point very well made. I think all of us have that exact same reaction as give me the prescription and let me be on my way. But saying yes to the consultation may save us a lot of grief down the road. So again, thank you for that and much more valuable information that was presented in this last hour. Up on the screen right now is information on our next education in this cognitive series with the MLK and Cleveland Clinic. This is Rest or Resilience, the Aging Brain, June 7th at 10:30. We are always with you on the first Monday of every month. This is a monthly series brought to you by the Cleveland Clinic, the Lou Reveau Center for Brain Health, and MLK Center. So we do want to take this opportunity to thank them again for hosting and supporting the education that we're able to bring to the community. So do feel free to join us on this. I'm going to put in the chat box real quick, if I can pull that back up. This is information on the memory screenings that Brian was just speaking about. You can contact us. My email address is here in the chat box. If you'd like more information on getting a free virtual memory screen scheduled, please email us at that address and we will contact you with time slots that are available and get you scheduled for a free memory screening. I'll also put in here healthybrains.org where you can go for more information on activities and, whoops. Hard for me to type and talk at the same time, so maybe there's a lecture that we're going to do on that. Healthybrains.org. Please feel free to go to that website to see more about information and education and activities that are going on there, as well as some clinical trials that they have available. You can contact them for more information on that. Okay, this is our contact information, info at Dementia Care Education. If you have any questions for us, we are social media savvy and love to stay in touch with those of you that follow the education. So please feel free to reach out to us on our social media platforms. We also invite you to subscribe to Brain Health 365. We did our first podcast that was on here with the Cleveland Clinic with Dr. Aaron Ritter. That dropped a couple of weeks ago. So if you want to jump in on that, then you'll be able to hear that conversation on normal brain aging, or is it Alzheimer's? The next one has dropped just recently, also on medication and mind fog. So feel free to join us there. Subscribe to the podcast and you'll receive automatic updates when they're available. That is all that we have for you today. Thank you again for hosting and for supporting our education today. We enjoyed being here today with everybody. This is Dementia Care Education signing off for today.
Right. right, thank you all very much for coming, and we hope that you enjoyed or got something out of this. If you have any questions, feel free to chat us, email us, or give us a call. And have a great day. Signing off from MLK Senior Center here in Las Vegas, Nevada. Thank you, and have a great day.
Thank you.
Thank you. Bye-bye.